We had B-52s. We had KC-135 tankers and also fighter jets at our base. And so we try to take good care of our people flying those planes to where they didn't have aerodontalgia, which is a toothache up at altitude.
Oh, you're kidding.
And so if anybody you thought might need a root canal because they had a deep filling or nerve exposure, our commanding officer said, do the root canal because they don't want to have to turn one of those planes around.
Yeah, exactly.
Have you ever heard of aerodontalgia?
Nada.
It's really divers. We have divers offshore that it's the changes in air and pressure.
Oh, okay.
And it can cause it's called aerodontalgia.
Okay.
And it's a real thing when you got a toothache up in that plane. And so we had to look at that a little bit differently than you did in private practice, and where you didn't have those people flying around.
Oh, yeah.
So, but anyway, we took care of them and the best we could. And it was a great 2 years because really I got 2 years of a rotating internship where I did the first. You want me to tell you about that?
I would love you to tell me about it, buddy.
The first 9 months, we'd see a patient every hour, and we did silver fillings and tooth-colored fillings, basically operative dentistry for 9 months. And then you rotate into oral surgery and examination where you might have, it's called sick bay, and you might have 50 people show up at 8 o'clock or 50 people at 1 o'clock, and you had 3 or 4 dentists working in that section. And it was overseen by an oral surgeon who was really helped us a lot and as young dentists, which showed us some tricks of the trade that we were able to use in private practice. But we did extractions basically for 4 months.
No kidding.
Including wisdom teeth. And then we rotated into endodontics that did root canals for 4 months.
No.
And then we rotated into removable pros and fixed prosthodontics, where we had our own removable lab in the hospital. And our crowns were sent to Barksdale Air Force Base in Shreveport, Louisiana. I was stationed in Warner Robins, Georgia.
No kidding.
At Robins Air Force Base.
What were those crowns looking like back then when you sent them out to the lab? Looking like
I mean, they've improved a lot. I mean, you still had the opaquer under the porcelain, and I mean, it doesn't look as natural as the KDZ Bruxers or Emax or the Bruxer Aesthetic or the KDZ Ultras with the Noritake porcelain.
Yeah, look at you, Don. Those are my products, baby.